Welcome to The Exam Room with your host, Dr. Rhiannon Windsor. In this podcast, we explore how value-based care is transforming healthcare for the better. From probing today's challenges to charting innovative breakthroughs, we're here to dissect what's shaping the future of patient-centered healthcare. While the progress in 2024 under the ACO REACH model was encouraging, it didn't come without challenges. In this episode, we reflect on some of the barriers we faced and the valuable lessons learned along the way. We'll hear real-world examples that demonstrate how these quality improvements are impacting patients' lives and explore how shifts in patient engagement and behavior have played a role in driving better outcomes.
So it sounds like we were able to identify some challenges and overcome those. Were there any other particular barriers that you think we had to overcome, and what lessons did we learn from that?
I think I would like to talk about the team at FQHC. The barriers were they obviously did not know much about value-based care. They didn't know that there is a shift from fee-for-service versus value-based care. And that idea took a little bit time to get hold on. And then they knew what needs to be done. That was one of the major barriers. The other barrier that we also noticed was teamwork, lacking teamwork. We found that there were people working in silos. They would one was doing something and another team was doing something, but there was no communication between them. So we had to be that person or team on our side. We had to bridge that gap between them, and we had to tell them, hey, you have another person working on this. Did you know that? Could you communicate with them? So there were a few instances where we had to do that, and they realized that the work is being done. We just need to communicate amongst ourselves and do it as a teamwork and get things moving for them.
Our FQHCs operate at such a big level that sometimes it's nice to have that outside perspective to look inward and provide those suggestions. Because specifically with that example that Dr. Siri was mentioning, we were looking at chronic condition management and care management, and what's the difference between the two and how do we combine them so that we're optimizing our efforts to ensure that we're getting the proper care to our beneficiaries. And that's when we realized, well, we have our CHWs here who are doing chronic condition education, and then we have our care manager over here who's doing specific care plans. They're both talking to the same patient. And instead of having them work separately, why not combine the two? And that's when it benefited the beneficiary, because then they're only having one touch point instead of multiple ones. And it's easier because then it's less confusing as well. The system's already so complicated, why not make it more streamlined and optimized? And I think that's the nice part where we were able to step in. And I think that there in itself proved successful. And so we were able to then use that model for other FQHCs and kind of implement similar methodologies and workflows and prove its success, in different populations, but same process. And it's all about streamlining and optimizing the workflows. We can't make assumptions for our population. We have to look at the data or speak to our beneficiaries, know who they are. That way we can do tailored interventions for them. And so there has to be those data-driven strategies to optimize our success and ensure that we are meeting our new goals. Because when we make assumptions like that with telehealth, we're not providing the resources that might help them meet those barriers. And so right there, I think it's exactly what the point is you have to know your population, not just make assumptions, because I can tell you right now, Cochise County is way different than Pima County than it is Maricopa County. And even though we're in the same state, drive an hour down south and you're looking at a whole nother population with different issues and that require different solutions. And that's kind of the tailoring that's required.
And if you don't drill down within that population to the subpopulations and ask those questions, then you're doing the patient a disservice.
It is unfair to assume anything about a patient without giving them a thorough questionnaire or assessing them overall, because it could be transportation, but you might think, oh, he's 65, more than 65 or 80-year-old, he or she will probably not understand what his disease is like. But you haven't talked to the patient. They might be the most intelligent patient on the planet, and you'll be surprised to when you start having that conversation with them that, oh my goodness, this patient is very involved in their care. He or she can get better for sure.
And I think that's one of the things that we've seen. One of our FQHCs really started leveraging their patient portal. And so that direct communication where they're able to talk to their PCP or nurse, ask those questions that they have, get that instant feedback, keep their documents there. That in itself helped, ease the burden of having so many different people to talk to, and not making that assumption, offering that. And then if they're interested, they'll outreach for it and they'll enroll themselves and they'll use it, and you'll see that engagement there. And so exactly like Dr. Siri said, you have to know your population and be willing to talk to them and get to know them.
Yeah, which takes time.
Yes, it does. It does. It does take time. It takes effort. But if we have a good team and they know what they are doing, communicating amongst themselves, they can utilize their limited resources in the best possible way.
Right, and maybe this is a bias for me, but it's healthcare. Is there anything more important than caring for a person's life and their health?
There isn't, but yep, everybody needs to realize the importance of that.
Are there any patient stories that jump to mind that illustrate the improvements, the successes that we've had in 2024?
One that we had, 2 sisters who were both our beneficiaries, went to the same health center. For some reason, we just never made the connection that they were sisters until one day, one of our CHW, she outreached, made the phone call, and then that's when we found out, wait, these 2 are in the same residence, same address, both are expressing similar issues. Oh, they actually go to the same doctor. So we were able to make that connection, and we started doing the weekly follow-ups. Both of them were frequent ED flyers. Very rarely went to their doctor. They had many missed appointments, and a lot of it was social isolation because they did live about an hour out of Tucson, kind of in the mountain region in San Manuel. And so when we spoke to them, the idea was that they kept missing those appointments because they didn't feel listened to, and they didn't feel like they had a voice to be heard there, and that they kept having these questions but nobody to answer them. And so one thing we had to do was reestablish that trust with the health center and assure them that they would have a PCP appointment there. They'd have somebody to talk to. And so it was a lot of connecting them with the care management team at that FQHC in hours. And so one thing we had to do was we did telehealth referral for behavioral health. And so that, alongside that PCP connection, reestablished them back into that health center. I think we had that conversation in August, and by October they had their annual wellness visit. And it only took us 2 months to get them back into that system. Since then, they've been proactively seeking those appointments and going in for their checkups as needed. But at first was, us doing that phone call asking, okay, well, what are the issues? Why didn't you want to go in? And once we were able to kind of address those, we then took it back to the team at the FQHC. They were able to review, see what they can do, get those appointment slots scheduled for them, and make those accommodations as needed. One of them, she was locked away in her trailer, had the windows taped up with sheets. She just didn't want to leave. And once she made that connection with Jeanette, our care manager, she had somebody to go to, somebody to talk to. And then we showed her, it's not just us, it's also our FQHCs. They want to know from you, they want to talk to you. And since then, she has weekly check-ins. She's calling us in. That really showed that something as simple as going to the ED multiple times wasn't just that. There was a deeper issue underlying it. And it just, having to ask those questions and find that out, and then you know how to solve it.
Yeah, and sometimes not knowing what's going on with you is so scary that you just isolate yourself. Once you know, there's relief that comes with that. If we have patients that are already in isolation, something's going on with them that could be treated on an outpatient basis, but they're too scared until it becomes an emergency, and that intervention, I think, is critical.
And I think right there you mentioned a key thing, which there are patterns. There are certain flags, and that's one thing that Dr. Siri mentioned earlier with my high-risk workbook, is that we can proactively identify those high-risk beneficiaries based on their utilization patterns, based on their chronic conditions. Was there an exacerbation episode that happened? And with those certain flags, we can then prioritize certain individuals who we know are higher risk to have worsening conditions and be proactive about it. Reach them before their health deteriorates. And that's the proactiveness that needs to be happening. And I think that's the mindset that our FQHCs clicked in 2024. And that's why we were able to see the improvement from quarter to quarter. And now with the switch from REACH to MSSP is a little bit more aggressive. With the quality measures, there's a lot more focus on preventative care and chronic condition management. Same beast, just different nature of how you tackle it. And so it's still continuing those patterns, and I think that's what will help us see success eventually in 2025. But you have to be proactive about, creating those tailored solutions.
Absolutely. Well, I am sitting here feeling very grateful for the work that you guys are doing.
Yes, and thank you for bringing it to everybody's limelight, right? Because people need to know about this.
Yes, and hopefully what you've shared can, be carried back and used to improve patient care in other places as well.
We are geared for success is what I would say.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.